In continuation with Mother's Day celebrations, I like to say, माँ शब्द का अर्थ होता है जन्म देने वाली. जो शिक्षा का ज्ञान दे उसे शिक्षक कहते हैं, जो खुशियों का वरदान दे उसे माँ कहते हैं. लबों पे उसके कभी बद्दुआ नहीं होती, बस एक माँ है जो मुझसे कभी खफा नहीं होती. Which is of great clinical relevance. And the speaker is Ma'am, respected Madam Sharda Jain. She needs no introduction, but still I want to say a few words about her. Harding Medical College. She is founder and secretary general of Delhi Gynecologist Forum Delhi Gynecologist Forum. She is member and expert obstetrician and gynecologist in ethical committee of MCI for the period of 2018 to 2020, and again in National Medical Council from 2021 to 2023. She has been decorated with Life Achievement Award and Living Legend Award by many prestigious bodies. And she has been passionate about teaching safety of doctors and creating medico-legal awareness. Welcome, ma'am. And to chair the session, we have galaxy of experts from two specialties today. It is a unique CME today. We have obstetricians as well as dental physicians to chair the session. First of all, I would like to welcome Dr. Geetika. Geetika Sharma. She is a senior dentist and she runs her own clinic for the last 20 years. She is chairman, convener of Continued Dental Education, Indian Dental Association, East Delhi branch. She is course convener, I Can Care Oral Oncology Connect. She has been conducting camps for oral screening in various parts of East Delhi. Next chairperson is Dr. Sonia Khera. She is BDS, LLB and LLM. She is graduate from KL ES Institute, Belgaum. She is a law graduate from IME College, Sahibabad. She has done masters in criminal law. She is running her own for 7 years. Next chairperson I would like to invite is Dr. Ambuja. Dr. Ambuja Sharma she has done her BDS from Maharana Pratap Institute of Dentistry, Gwalior, and she has her own clinic for last 7 years. Another chairperson from dental department we have is Dr. Gitanjali Bansal. She is a graduate from CCS University. She has done MBA in Healthcare Services from Manipal University. She has her own clinic at Jilmil. From Galaxy of Obstetricians, we have Dr. Meenakshi Sharma, who is a graduate and postgraduate from AIMS, and she is presently Secretary of EDGF. Next doctor I want to invite is Dr. Nirja Vashne. She is a senior consultant in OBGY at Cloud9 Hospital, Paparganj, at Bimla Devi, Mayur Vihar, and at Garg Hospital, Karkaduma. Her special area of interest is gynae endoscopy and urogynae. Welcome, Dr. Nirja Vashne. The next person I want to invite is Dr. Deepti Nag. She is Director, Mother and Child Healthcare Center. She is a Senior Visiting Consultant at Max Patparganj. She is Vice President EDGF and she is Ex-Secretary EDGF. Her special area of interest is infertility, high-risk pregnancy and menopause. Now I request Dr. Sharda Jain ma'am to give her deliberation.
All the dental experts who are here, and I'm sure we are enriched by other gynecologists things which they have seen in their own obstetric practice. So let me just take 1 minute to share things, and then I will. Hope you can see my slides.
Yes, ma'am.
Yes, ma'am.
Hello. Yes. Okay. Now this topic is let's understand oral health concerns during pregnancy. Pregnancy, as you all know, is a teachable moment. not only that she becomes pregnant, she's ready to, at this particular time, to listen to many things, how to become a homemaker, because unless she becomes mother, her homemaking job is incomplete. And I think at this particular time, both husband and wife are very keen to learn new things. Now, lot many changes happen as far as oro-dental issues are concerned, and we need to know ourselves, and then only we can guide our pregnant patients. Our elders used to say that you lose one tooth per pregnancy. And what is the truth? We want to know what is the correct. And I was interacting with my dentist friends, and they said, Dr. Jain, this was probably maybe true about 20, 30 years back, but this is no more true. But I think our gynecologist colleague are going to definitely share about things. Now, we need to learn ourselves, and then only we can tell our pregnant patients how pregnancy can impact oral health of a woman. And probably it will clear the confusion, because when she has a problem, dental problem, she's confused whether she should contact her gynecologist, because without her permission, she will not show it to anybody, and whether she go to dental physicians directly. Now, why complete oral health is important during pregnancy? We all know that increased hormonal changes in the body take place, and majority deteriorate body response mechanism. Increased susceptibility to dental plaque and oral bacteria is there. And there's an increased risk of developing oral and dental diseases. I will highlight it a little later. And there is a spread of infection from the mouth of the mother to the developing fetus as well. Now, how pregnancy impacts the oral health? The foremost is that hormonal changes in pregnancy combined with a neglected oral hygiene increases the incidence of oral disease like gingivitis or mild gum disease. High levels of circulating progesterone leads to pregnancy gingivitis, characterized by increased redness, edema, and higher tendency towards bleeding. Vomiting during pregnancy increases the acid environment in the mouth, leading to the formation of caries during the pregnancy period. And this periodontal or gum-related diseases during pregnancy are associated with preeclampsia, gestational diabetes, and it is possible risk factor for having a preterm and a low birth weight babies. So probably this never occurred to us that, her dental problems can give rise to obstetrical problems like PET, gestational diabetes, preterm baby, and a low birth weight baby. Now we want to know what is the extent of the pregnancy-induced oral health burden. As far as the data is concerned, and mainly this is Western data, not much of Indian data is here, but I'm sure if it is Western data, and from our own experience, we can probably relate it, that it probably coincides a similar way as far as the Indian pregnant patients are concerned. Nearly 60 to 70% pregnant women have gingivitis or mild gum disease. And nearly 63% pregnant patients or 65% patients are prone to dental caries or tooth decay. Nearly 50% of females during pregnancy are prone to demineralization of teeth, and 30 to 40% pregnant ladies may be at an increased risk of periodontitis or serious gum infections. So during pregnancy, not only she has a lack of knowledge, she has a dental phobia that, during pregnancy is not the time to consult for any dental treatment. So with these kind of things, let's see what is in store for her. The two most common dental issues during pregnancy which crop up are dental caries, which is in other words is tooth decay. Secondly is gingivitis and periodontitis, that is gum diseases, which is there. So looking at these pictures, I am not surprised when the elders used to say कि हर pregnancy के साथ एक तो दांत जाएगी. Now, when you look at these pictures, you find it is not very uncommon when you recall your pregnant patients. Not a small number. Nearly 60 to 75% of pregnant women have gingivitis. That is gingival inflammation. They have gum bleeding, especially during toothbrushing or flossing. This occurs right in the first and the second trimester itself. At early periodontal disease that occurs when the gums become red and swollen from inflammation and may be aggravated by changing hormonal levels during pregnancy. What are their signs and symptoms? Infections of the structures supporting the tooth, including gums, the ligament, and the bone, is known as periodontitis, caused by undiagnosed or untreated gingivitis and can lead to tooth loss. Healthy gums gingivitis and periodontitis. That is, you can find there is a gingival recession, gum recession. There can be increased tooth mobility. There can be alveolar bone loss, and finally the loss of attachment of the tooth from its support. So you can find that a few people can have a healthy gums while gingivitis is very common, and when it goes unattended, it will give rise to periodontitis. There's another term which is used as pregnancy tumor. I did not know this about term, but I'm sure we have all seen this kind of a growth which occurs during pregnancy. During the trimester, some women may experience overgrowth of tissue called pregnancy tumors or on gums. This swelling is typically found between the teeth and is believed to be caused by excess plaques. A UK study shows that gingival and periodontal diseases, the research has been found a considerable link between gingival disease in pregnant women and premature low birth weight babies. Not only prematurity is there, but the baby is also low birth weight. And according to them, 1 in 5 can have premature birth due to linked severe gum infection, and that is periodontal disease. 1 in 5. Approximately the incidence of preterm delivery is around 8%, but this is 1 in 5 is too much a number. The babies who are born prematurely may be at an increased risk of developing a range of health conditions, cerebral palsy, brain injuries, or hearing and visual deficits, depending upon how much is the prematurity. Now, what we find another thing is during pregnancy, the pregnant ladies have increased sugar cravings. And naturally, when the cravings is there, there's an increased sugar consumption. And this leads to increased chances of dental caries. During the first few months itself of pregnancy, some women may have extreme interest in snacking, especially the processed carbohydrates, and the toothbrushing can be neglected after they eat these kind of sugary things. Saliva flow also decreases, and hence the formation of caries increasing during this period. The women who have a lot of cavity-causing bacteria during pregnancy and after delivery can transmit these bacteria from their mouth to the mouth of the baby, and there's increased sugar cravings, increased sugar consumption, and increased chances of dental caries follows one after another. Morning sickness is a part and parcel of pregnancy. Now, how to take care of your teeth after vomiting? It is said avoid brushing your teeth immediately after vomiting. While the teeth are covered by the gastric acids soon after vomiting, the action of brushing may scratch the tooth enamel. So you rinse your mouth thoroughly with plain tap water, or follow up with mouthwash containing. I think my dental colleagues are going to tell you about what kind of mouthwash to be used, and wait for an hour after vomiting before you brush your teeth. So what you have to do is, do not brush your teeth for an hour or so after vomiting. You only rinse it with tap water, and the maximum you can do, put a mouthwash for cleaning up things. Whatever is you find in many of the toothpaste or mouthwash preparations which are available, they have at times a preparation. So it is, dentists always say that never swallow your either the paste or this mouthwash fluid. Now, which mouthwash? I really do not know anything about it, to be very frank. If you don't have a lactoferrin mouthwash, put a blob of toothpaste, which is friendly with pregnancy, on your finger and smear it all over your teeth and the gums. Keep it for some time, rinse thoroughly with water afterwards, and preferably this paste and the mouthwash should be free of SLS, chloride, paraben, gluten, peroxide, and triclosan. Denti 9 toothpaste is available, and they have a wash of the same by the same name. You can see here Denti 91 and the mouthwash, specially made for a moms to be. There's another term known as retching or gagging while you're brushing your teeth, especially if you are brushing your posterior teeth, can cause gagging. However, it is important to brush all your teeth to avoid tooth decay, because whenever we are doing this kind of thing, we leave our brushing halfway. But it is important that we must brush all the teeth completely, and you will come to know that even if you brush, we find that everything which is need to be removed from your teeth does not go away. So, gagging while brushing teeth, what are the precautions and the tips you should take? Use a toothbrush, small, soft head, such as brush made for toddlers. I repeat again, brush made for toddlers. Take your time, go slowly with your brush. It may help to close your eyes and concentrate on your breathing. Try to listen music, and then you try to see that you avoid this particular phenomenon of gagging while doing the brushing. If the taste of the toothbrush causes you to gag, switch on to another brand or brush your teeth with water and then use mouthwash. Go back to brushing with a toothpaste which is 100% safe. Now, how to avoid dental problems during pregnancy? It is said that home care regime is required, or consult the dentist when it is really required. What about the home care regime is thorough toothbrushing twice a day for 2 minutes. And mind you, 2 minutes बहुत बड़ा समय होता है, 1 minute ही बहुत बड़ा होता है. So it is advised the brushing has to be done for good 2 minutes. Using a proper toothbrushing technique, effectively removing the plaque from the teeth. Pregnant women bleed more readily due to effect of pregnancy hormones, that is estrogen and progesterone, and may consequently avoid brushing their teeth because they feel that, every time I brush, it is going to bleed. As a result, the bacterial plaque formation increases. Therefore, in pregnancy, the mouth needs utmost care. This is the way of technique, whether it is a child and whether an adult, whether people like us or anybody. That you need to take 2 minutes when you see all these 6 steps, and you can find that either it has to be angulation, then has to be parallel, then the inside of the mouth, then the upper part has to be done. Every part has to be cleaned up. Toothbrushing alone only cleans 60% of total surface of the tooth. I repeat again. Toothbrushing alone only clears 60% of the total surface of the tooth. Cleaning in between your teeth helps to remove plaques and food lodged between the teeth and beneath your gums. These are the areas where toothbrush cannot reach. Interdental brushes and the floss helps to dislodge the plaque and bacteria which may still be present and interdental spaces after thorough toothbrushing. Gargling with non-alcohol based mouthwash or a warm salty water helps to remove any lingering and loosened debris. Warm saline rinses relaxes your gums and reduces gingival sensitivity. The fluoride mouthwash can help to prevent tooth decay. But again, probably a comment will come from my dental colleagues that, they do not advocate fluoride paste or the fluoride mouthwashes during pregnancy. Therefore, flossing and the mouth rinsing must be performed at least once daily. Goes without saying that one needs to avoid smoking and alcohol during pregnancy. Periodontal inflammation and destruction increases in patients who smoke. The possibility of abortion or stillbirth or a premature low birth weight babies increases among smokers. Overconsumption of alcohol is teratogenic in babies and can cause, if taken early and in a too much amount, as a fetal alcohol syndrome. Various dental anomalies can take place as a result of the same. Smoking and alcohol have hazardous effect on the developing fetus as well as on the expectant mother and must be avoided under all circumstances. Follow a balanced diet. I don't need to give sermons to the gynecologists, but we all know about it, that when we talk of balanced diet, it should be rich in iron, calcium, vitamin B12, vitamin C, and vitamin D. The calcium has to protect your bones and fulfill the need of your developing baby as well. Good sources of calcium include milk, cheese, plain yogurt, sugar-free fruit yogurt, calcium-fortified preparations of soya, almonds, and other types of milk and things are available outside, and they are slowly incoming as far as our country is concerned. Vitamin D helps the body to utilize calcium. Good source of vitamin D includes some fatty fish, eggs, vitamin D, fortified milk, but now we know that at least during pregnancy, you have to not only take calcium, but its absorption, the vitamin D has to be also taken. Your doctor may also prescribe you vitamin supplementation during pregnancy. Go easy on sugary snacks. Avoid in between meal snacking, especially refrain from refined and unprocessed carbohydrates, sugary food, and fizzy beverages. Such food items are known to have higher risk of tooth decay, and try to snack on foods low in added sugar or fresh fruits instead should be taken. Rinse your mouth with mouthwash containing fluoride or brush your teeth after having sugary snacks. Again, I would like to have a comment on the fluoride mouthwashes from my dental colleagues. Now, when you need, you should not hesitate to consult your dentist. Why consult a dentist? For a prevention and for the timely management of complicated oral health issues like routine dental checkups, prophylactic scaling, and preventive restoration, which is required at times during pregnancy. Emergency dental issues during dental disease can lead to tooth loss and subsequent bone loss, which can be treated by reconstructive and regenerative surgeries. Initial dental caries can progress to deep carious lesions, necessitating endodontic therapies, or in worst cases, may require tooth extraction followed by prosthetic rehabilitation. Pregnancy tumor may need to be excised surgically. Emergency dental issues during pregnancy and their treatment, now we have become very wise, and we take help of our dental colleagues for all these emergency problems. Dental treatment and myths during pregnancy are: the benefits of receiving dental care during pregnancy far outweigh the potential risk. So it's good to consult early than late. The safest time to undergo dental treatment is the second trimester of pregnancy. The safest time to undergo dental treatment is the second trimester of pregnancy. The emergency dental procedure, that is tooth extraction or a root canal treatment, can be performed following strict protocols. Elective dental procedures like bleaching, veneering, cosmetic surgeries should be postponed until after delivery. So let's recap. Oral health is essential to general health and well-being across lifespan. Women may be more prone to gum diseases and cavities. If the mothers have a higher levels of untreated cavities or tooth loss, their children are 3 times more likely to have cavities. So that is the relation between the problem of the mother and the baby which is going to be there. The facts are that nearly 60 to 75% of pregnant women in the Western world have gingivitis. If the mother have cavities, then their babies are 3 times more prone to have cavities. And 50% of females during pregnancy are prone to have demineralization of teeth. And 30 to 40% of pregnant women may have increased risk of periodontitis or serious gum diseases. And 65% of pregnant women are prone to develop dental caries or tooth decay. So this summarizes that not only people have pregnancy gingivitis, mouth dryness, gingival tissue ulceration, pregnancy tumors, and as a result of this, they can have premature delivery, 1 in 5, preeclampsia, and low birth weight babies. Hence, the prevention of oral and dental problems and their complications during pregnancy is mandatory by exchanging appropriate knowledge, attitude, and oral hygiene practice at the right time should be taken. Pregnancy is an exceptional phase in a woman's life. The studies have reported that the oral health care need of pregnant women are completely different from that of the general population. So always remember, healthier mouth of the mother, the healthier babies they're going to be. 40 to 20 weeks time is the dental work is safe during pregnancy and is recommended during pregnancy, during weeks 15 to 20 weeks of pregnancy. Approximately 40% of pregnant women have some form of periodontal disease, and having your oral health checkup while you are pregnant is important. 7 times studies have shown that the pregnant woman with periodontal diseases are 7 times more at risk of delivering a preterm low birth weight babies. This is I wish to emphasize is that if you have these periodontal problems, 7 times more risk of delivering a preterm low birth weight baby is there. So the choice of the paste and the mouthwash is Dente 91. Which mouthwash to be used? It is said, if you don't have lactoferrin mouthwash, put a blob of toothpaste friendly with pregnancy on your finger and smear it all over your teeth and take a while, rinse thoroughly with the water afterwards. Do not swallow this particular paste ever. And preferably you should see that it should be free from SLS, chloride, peroxide, gluten. Pregnancy is a time for smiling and a time to pay extra attention to your teeth and mouth. So this is the preparation for a great smile during pregnancy. I was told when I was getting a briefing from this drug house, they were advocating the same paste and the mouthwash should be used for a dental care after 50 years, after 60 years, and after 70 years. Again, I would like to listen from my dental colleague and fair and very honest comments by all my gynecologist friends. So thank you very much. Do not hesitate to make comments.
Thank you, ma'am. Thank you for your pearls of wisdom. This was an exceptional talk on a very unique subject, something which has never been emphasized earlier ever. So there are lots of tips that we are getting from ma'am today, and we have a whole list of eminent experts who are going to tell us more about it. So the first thing I've learned is that oral hygiene and taking care of the dentine is as important as any other part of the body, and that we must look into the oral cavity and examine the patients and probably send them for a dental checkup in the second trimester. And of course, it is also gingivitis and dental caries is also responsible for preterm birth, for FGR, and for preeclampsia. This is also kind of news to us and very, very important. Ma'am has told us exactly how to brush the teeth, everything. But yet, I'd like to hear from the experts. So over to Dr. Sonia. Could you tell us a bit about...
Dr. Geetika is the senior most, so let's hear her wise comments. Dr. Geetika.
Thank you. Thank you, ma'am, for a wonderful lecture. And it was so clear and precise that I think that the role of the dentist starts the day a woman plans her pregnancy, she is confirmed that she is pregnant. So the role goes hand in hand with the gynae and the dentist. Both have to work together to have a healthy baby. We need to really educate our patients that oral care is equally important in the pregnancy for a healthy baby. Fluoride part of Dr. Sonia ma'am will be taken.
So ma'am, you've worked a lot on tobacco and also,
Yes.
do you think how does smoking affect the dentine health? Any particular comment you want to make on this?
Yeah, because of smoking, many pregnant women, they suffer prenatal birth, low birth weight problems are there. They do not know. We need to educate them for this also. And second-hand smoking and third-hand smoking also again harms the child equally.
Thank you so much, ma'am. Dr. Sonia Khera, we'd like to have your expert views.
Good evening and congratulations to Dente 91 for an absolutely great launch. I'm very happy to see that it is a fluoride-free, almost fluoride-free toothpaste and can be used even for gargling. Even a bit of toothpaste can be used for gargling. So as the toothpaste has mentioned, the fluoride content is less than 4 milligrams per liter. I think that is advisable in pregnancy. The more of fluoride can lead to, sometimes we mention the patient not to gulp the fluoride toothpaste or mouthwash, but since there is a gag reflex that has been mentioned by ma'am in the PPT, patient tend to gulp or intake the fluoride, which leads to fluoride toxicity in pregnancy. It leads to preterm babies, can have an effect on the IQ level of the babies. Like there are studies in Canada, in 6 states of Canada, which has shown and which has been confirmed by Dalhousie University, India, that there is an higher risk of lower IQ. Like IQ of the baby is just 4 or 5 in the pregnant women who have brushed from fluoride toothpaste. So I believe that there is an appropriate content of fluoride in this, and this shall take care of cavities, caries, periodontal diseases, and that's it.
Thank you, Dr. Sonia. So that gives us the message that we must tell pregnant women what toothpaste to buy and what toothbrush to buy. And can you give us just a little bit of, when we examine the oral cavity, what are the points we should keep in mind, like as a gynecologist?
Yes, as a gynecologist, the most important thing is the bleeding gums. The symptom that is very relevant and very easily can be diagnosed is the bleeding gums. As soon as the pregnant lady or the patient complains of bleeding gum, I think we should both together, the gynecologist and the dentist together, go hand in hand and treat the patient, because bleeding initiates gingivitis, which results in periodontitis, that is the bone loss and the tooth mobility. So let's combat this fad that one pregnancy will make you lose one tooth. We can do it that way. Together we can do it.
Yeah, thank you, Dr. Sonia, so much. Dr. Ambuja, what would you like to say? We want your expert comments.
As Shada ma'am,
अब डॉक्टर्स को ब्रश करना ही सिखा दो, यही बहुत है.
ma'am, as you have said that tooth decay can affect pregnancy in number of ways. Like if there is a pre-existing decay, a cavity or a caries, which may be has been neglected for many like months or so, it causes hyperreflex reaction in the body, which may spread through the bloodstream from the mother to the baby, and again it will lead to premature birth and lesser weight and all the complications. So right now I'm not prepared with a brush and teething to demonstrate exactly, but what we are supposed to do, especially in the pregnant women, you should use a soft brushes, or as you say, a toddler brush should hold in this position and should be vertically move up and down. And most importantly, what most of the patients think, that we are supposed to clean our teeth only. It is a myth. We should move a brush from gums bilkul from the upper side to the lower side. There should be a massage of the gums along with the cleaning of the teeth, which may prevent this swelling of gums, bleeding and all. And if there is a bleeding, they should not be afraid that we should. Some patients stop brushing because there was bleeding, that's why we stop brushing. So they should not be afraid of it. They should clean properly. They should massage their gums with the brush properly along with the teeth. And as ma'am say, they should visit a dentist for all these problems, but they should not avoid using brush. Proper cleaning is necessary.
Thank you,
You
Dr.
wish to emphasize that I think it's a pre-existing problem. If it is neglected throughout during the pregnancy, probably tilts the things against us. And we must not forget the incidence of preterm and a low birth weight babies is 7 times more, and that's something scary. We did not know this. This is the kind of thing. Dr.
Gitanjali, ma'am.
Gitanjali, please.
Very good evening to everyone. First of all, ma'am, the lecture was absolutely amazing, and I think everyone have covered almost everything. I just put on just few light on just few things, that some of the precautions which every pregnant lady should follow. The main important thing is they should just take care of this thing, that while brushing, they should move their hands softly. It should not be very harsh, because already their gums are a little inflamed, and since because of vomitings, the tooth have already exposed with so much of acidic environment. So they should not be harsh, and make sure that they should spit the complete toothpaste properly. And if they are using correct toothpaste like Dentine 91, as ma'am have told, it should be SLS, paraben and fluoride free, or a little amount of things which are safe for the lady, then they should specifically should use that. And if it's not possible, then they should particularly focus on this thing, that they should brush and spit the whole stuff completely. They should avoid engulfing the foam. And secondly, what I think the important point is that they should go for a smaller head toothbrush, because it is a very major point, because they have a very strong morning sickness, and that big head brush that may cause gagging reflex. They may aggravate the gagging reflex. So they should go for a smaller head brush. It will be comfortable also. And most importantly, the bristles should be very soft, super soft bristles the pregnant lady should use, because obviously they cannot, they are even not getting even harsh. They have to use the correct brushing technique. So the thing, they should go for a soft bristles toothbrush. I think every point we have all covered.
Yeah, but what I want to say, that when will you want that a routine proper checkup should be there with the dentist? Because I think these fineries need to be told. And any supplementation do you suggest, like vitamin C or a glycerin massage of the gums or anything of this kind you want to do?
According to me, they should go right very from the first day, as Dr. Gitika have told this thing. Because if they are actually careful about it, so they should go it on the very first day when they detect that they are pregnant. And if somebody is already having an underlying problem of gingivitis or caries, something like that, so to that person, it's very, very particular that very first day they should go and approach to the dentist as well, parallel with the gynae, according to me. And For the supplement point of view, though, ma'am, I think, and if we have to go for any treatment, then the mid trimester is the best and the safest period. If any emergency treatment we have to follow, like many patients come to us with severe pain and we have to undergo root canal treatment with them because we don't have any other option, because already the patient is in so much discomfort of pregnancy and still the patients are crying, ma'am, excess pain hai, please isko relieve kar do. So in that case, we have to go and we follow the safe protocol. Like instead of giving Catrol DT, we prescribe them paracetamol. It's the safest and under the guidance of the gynae as well. And we usually avoid giving them heavy antibiotics. We usually take concern of their gynae that how the case is going on, and according to that we give them medicines. And if we talk about the supplements, then supplement what I think they should take, this vitamin C is the best supplement under the guidance of with the gynae, because with the help of vitamin C the healing process will be good. So the gums की जो inflammation है वो सब it will be easily and मतलब fastly it will be cured. तो
पेशेंट को अच्छा लगता है कि कोई गम मसाज बताओ, तो आप किस चीज का गम मसाज बताओगे?
Ma'am, Dentogel gum paint, I mean, we have so many types of gum paints. So I will suggest normal anesthetic gum paint, not an antibiotic gum paint, because definitely if she will apply a gum paint, antibiotic gum paint like Onicrate gel, then maybe she get engulfed and unnecessary exposure to antibiotics will be there. So anesthetic gum paint will be the best, like Dentogel gum paint. That will be the best option for the gynae patient, for the pregnant lady.
So thank you. My gynecologist colleagues, please share your experience, madam.
Thank you. It is Dr. Meenakshi Sharma's turn, but Dr. Chandralata wants to add a word. And Dr. Richa Chawla has given a very important point. She said that we must make dental checkup a part of our antenatal care checkup. Point very well taken. Ma'am has told us that flossing is important, mouth gargles are important, and even the gum massage is important besides brushing twice a day. And all these points have to be actually implemented. Over to you, Dr. Meenakshi, Dr. Chandralata ma'am, and then Dr. Meenakshi.
Ma'am, I want to tell one thing is that even, sometimes we are very afraid of getting X-ray of the, tooth during pregnancy. So nowadays they are doing, in a transverse way, which doesn't, previously they were doing diagonally. And then, it was affecting the, this thing, thyroid even, and even the, baby. Now they are doing in a transverse way. So even that can be done in second trimester, but even then, if we are very careful, she is afraid of it, we can put a, that lead apron, and especially we have to, safeguard the thyroid. There is another this thing, guard for thyroid. So that is very important, whether it is diagonal or this. So nowadays this is there, so even we can go for X-rays also, and dentists can go for tooth extraction and all these things. Even I have used this, quite a lot. I have used this Dent 91 Mom one. It's a good one. It's a good one. Of course, the females also think that koi special hame toothpaste or white, mouthwash mila hai.
Probably it's even important ki it's fluoride free. So that is important also.
And that lactoferrin as such is an, this thing, protein. And that helps in, reducing the lactoferrin is anti-inflammatory also. It helps in reducing the inflammation of gums, etc.
Wow. Thank you so much. Thank you, Dr. Chandralata. Dr. Meenakshi Sharma, would you like to say some expert things as usual? Dr. Meenakshi, over to you. Till she joins, we can have Dr. Dipti Nav to tell us something. Dr. Dipti? Dr. Dipti, Dr. Renu, anybody wants to say something? Dr. Nija Varshne, Ma'am, I would like to add one thing. जब हम लोग अपने दादा दादी और अपने parents को भी देखते थे, after every meal they would actually do a lot of rinsing. आवाज आती थी बाथरूम में से गुड़ 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 करके, and they would even do gargles, and then with the finger they would massage their gums. So I think this is a very good thing we should now take up. And of course, besides all the new things that have come up, we must do that. Don't you think so, Dr. Ambuja and Dr. Gitanjali Bansal?
Yes, ma'am. This is always the best way. After every meal, the patient, any person should go for gargles, and along with the gum massage, I would like to add that using warm saline rinses will also give a soothing effect to the gums. Like a pinch of salt in lukewarm water can give a soothing effect to the gums, and it will help in lessening the swelling effect. So this can also
Especially the pregnant lady, she already have the swollen gums. And if she goes for warm saline rinses, then that will be the best. That will be the best for her. Healing will be very good.
So warm saline gargles, another very important point to be added. And एक हमारी नीम की दातुन होती थी, and it's being sold over Amazon.com these days. It's the rate. What do you think about this?
Ma'am, one question.
है अब तो वो आती है Amazon पे मिलती है
that can be used additionally, but this is do the cleaning of the teeth, cannot be replaced by those datuns, as per my opinion.
Right, ma'am.
Actually, datuns can be a little abrasive for the pregnant ladies too. They can be little abrasive. They can be a little harsh. So instead of using them, she should go for a soft bristle toothpaste, extra soft in fact.
ठीक. Thank you
Ma'am,
so
what
much.
about massaging the gums with mustard oil, salt, and turmeric? To help in prevention of gingivitis. Is there any role? I don't know.
Yes, ma'am, it's still considered to be good. Or coconut oil pressing, even still we recommend to the patients.
Turmeric has antibiotic properties, so it is very much still the natural mouthwash, like Dr. Ambuja said, the warm saline gargles and the turmeric. The natural things are still being used, and they are highly recommended rather than going for anything which is chemically based.
So nice. So salt and turmeric, always in the deep. Since we are not able to hear from Dr. Meenakshi Sharma, in the meanwhile,
Dr. Renu, you want to make any comment?
Yes, ma'am. Ma'am, I have already said that we should tell the patients, whosoever comes for prenatal screening, we should ask them about the dental problem also, and they should treat their dental problems before they plan their pregnancy, which is very, very important.
so on Mother's Day, would you like to say something, Dr. Renu Chawla?
Mother's Day, I'll like to narrate dialogue for mother. जब जब कागज पर लिखा मैंने माँ का नाम, कलम अदब से बोल उठी, हो गए चारों धाम.
क्या बात है. Thank you so much. Dr. Seema Gupta.
Thank you, Dr. Shardajan ma'am. It was a very informative lecture. I think we had it for the first time in our forum, a lecture on dental hygiene, to prevent maternal and fetal complications. So it's very useful that we incorporate dental hygiene and dental oral examination in the antenatal care, as Dr. Renu Chawla has said. On the occasion of Mother's Day, I would like to share, a mother is one person who can take the place of all other people, but whose place no one else can take ever in your life. She's always your best friend, your confidant, and the person in whom you can keep all your sorrows, your joys, and your emotions. And a mother's name is synonymous with selfless giving, selfless love. And as we also say Mother Earth, धरती माँ, भारत माँ, तो सिर्फ देते ही देते हैं, कुछ लेते नहीं. ऐसे ही हमारी डॉक्टर शारदा जैन मैम है जो सिर्फ देती ही देती हैं, लेती नहीं, हमारी माँ. That's all.
अरे भाई.
Thank you so much.
I think, let's talk about the take-home message from this particular talk. This is my first talk in the last 50 years of my teaching career as far as the dental issues during pregnancy is concerned. And I go wiser after preparation of this presentation is that don't take changes during pregnancy in a in a very lighter note. This gingivitis and periodontal problems, if you neglect them, they are the cause of early tooth decay. And you may lose your teeth with every pregnancy. I think I am, whether Dr. Geetika wants to convince me that Dr. Jain, no more you will lose a teeth, but I think if we neglect ourselves, we can lose our teeth. And secondly is, there is a 7 times higher incidence of preterm birth and of a low birth weight babies, which we should never allow it to happen. And now, or for all dentists to know, for all gynecologists to know at least one name, कि आपके पास अगर पेशेंट ब्लीडिंग गम्स क्या है, पहले ही प्रिस्क्रिप्शन में लिख दो भैया डेंटे 9 डेंटे toothpaste and this thing, and tell them that please change your brush, get on to toddler's brush which you need to take, and थोड़े से जो cleanser water के spray होते हैं that you should try to use after rinsing your mouth with this. So at least every time you eat, you must get into habit of rinsing your teeth. And best way is what Dr. Divya Singhal has said, that whatever the elders have said, but dentists also prescribe the same, that आपने खाना खाने के बाद आपने इस तरह से gargle kind of a thing करना है, जिससे कि to and fro, this forceful movement of the water can definitely cleanse the muck between the two teeth which you have. So I think आपने एटलीस्ट एक टूथपेस्ट का नाम जाना और एक टूथब्रश का माउथ वॉश का नाम जाना, और आपको बहुत कुछ पता चला because of this particular walk. Till now I was not doing anything. जब पेशेंट के ब्लीडिंग गम्स होते थे, I used to write down कि विटामिन सी ले लीजिए मैडम और आपको ग्लिसरीन से मसाज कर लीजिए. But now I am much wiser after this particular presentation. So thank you very much, Dr. Geetika, Dr. Geetanjali, Dr. Sonia, and Madam Ambuja. Dr. Ambuja के बारे में मैं बताना चाहती हूँ. She is the daughter-in-law of Dr. Ava Sharma. So she is the daughter-in-law of the group. Am I clear? So, but my
daughter-in-law of CDGF.
And she was the one person who's made me friendly with the 4 dentists here. And I'm sure next time when we're going to talk about it, I'm going to hear Dr. Geetika can assign what should be the care after 50 years. I'm pained, there are nearly 70 people had joined the time of my presentation is, we do not know how to care ourselves. And I just want to tell you, at the age of 75, you can have all your teeth, and in anything which you lose, now the implants are available. The days are gone when the dentures were required. I think, we have to change with time, and, we will definitely have next month a talk by any one of you, what should be the care at 50 years. 50 साल में शुरू करने से पहले at least पहले preparation तो करनी पड़ेगी हमारे को अपनी. So I think, let's have a talk by them and, improve our own dental care and how to have a healthy gums, not receding gums. And I think it had been absolutely great pleasure, this thing. And I'm glad, people go wiser after this particular thing. So thank you.
Thank you, ma'am.
For taking
Thank you all the experts and all the delegates. Thank you all.
Thank you, everybody. Thank you, everybody.
Wonderful joining.
Thank you.
Thank you so much, Sharda ma'am and Denti 91 for sharing this platform and to take extra take care of these pregnant women. And I thank everyone to be the part of this unique amalgamation of eminent gynecologists and dentists. And I hope all of
it was our pleasure. It was our pleasure. And I think, thanks to you, Ambuja, in particularly, that, we could get in touch with other dentists as well.
Exactly.
my pleasure, ma'am. And I hope
You will take a lead. You will take a lead because, when the Dente 9 people were approaching me, they said, Dr. Jain, you should try to use this particular toothpaste because this toothpaste is just like pregnant patient is for you also. So I think next time we are going to hear from you on this particular regard. Okay?
Definitely.
And I would like Ambuja to see to it that, we, combine it with any of the activities in future.
My
So
pleasure.
thank you.